This patient actually, he started to have symptoms first presented with numbness of the both hands in 2017. He went to his nearer clinic, general practitioner, and they found out actually he has this possibility of this related to nervous system, as well as the further investigation found out he has this hypercholesterolemia. Then they started off the medication to him and giving him high cholesterol medicine, beside that for the nervous system as well. However, throughout the months when he's taking this medication, he started to develop this proteinuria, means actually urine having bubbling. He's noticed that, but his condition is not improving. In fact, he become a little bit more swollen, and then he went back to see his the general practitioner, and then they refer him to nephrologist. That was somewhere around 2018. So he also having the other symptoms like acid reflux symptoms, and also he feel a bit more tiredness at that point of time. And when he saw the nephrologist, they diagnosed him having this nephrotic syndrome with high cholesterol disease, and in which he was given the changed medication, the high cholesterol medicine, as well as giving the high dose of corticosteroid medication to control his nephrotic syndrome. However, after he started off this medication, a few months down the road, he started to have even more tiredness. The urine bubbling is not improving, and also, of course, the medications that control the cholesterol is better, but the patient feel very uncomfortable because he started to have other symptoms as well, in which he has reflux symptoms as well at that point of time, and the sleep is not so good. So he was followed up with a nephrologist. Condition is not getting better. So subsequently, a few months down the road, the nephrologist decided to do a kidney biopsy for him to find out actually what happened to him. And he was underwent this kidney biopsy and found out to have this proliferative disease, in which we call it a messenger proliferative glomerulonephritis, and which is a part that causing his nephrotic syndrome. Then there was add in medication for him, additional medicines, anti-inflammation agent, which is called Celsep, and also continue with this anti-cholesterol medicine, and giving him all these gut medications to suppress his symptoms. However, his condition is not getting better, and he developed more problem in which the tiredness become more, and then the body feel very uncomfortable, and then the sleeping is not so good even, and the gut symptoms have become more. He started to have intermittent diarrhea, and also the condition is not getting better. So subsequently, he defaulted the treatment from this nephrology. He stopped the medication, and he see his another doctors from traditional Chinese medicine in Chinese medicine hospital. So he was given the herbs to treat his nephrotic syndrome and his the side effect of the due to the drugs medication he take. He trying out for about 3 months down the road, but the condition is not getting better. So then he found us. Then when I first met him, he has the few problems that actually I noticed. Besides, he has this nephrotic syndrome. He also having he's developed the Cushing syndrome because of the medications prior to seeing me, and also he also have this toxicity, which is actually previously, I think, it related to his amalgam dental fillings, as well as also other toxicity as well, right? And then beside that, also he has also this hormonal problem in which the body have Cushing syndrome related, because the corticosteroid causing him this cortisol low, the hormone low. So all this end up make him actually unable to sleep well, energy low, he cannot perform his work, and he has this also irritable bowel syndrome in which the gut is actually uncomfortable, and with also the acid reflux symptoms. The root causes of the medical condition for this patient include the bad gut health, organic, inorganic heavy metal toxin exposure, lack of essential nutrients in his body, hormonal imbalances in his body, mitochondrial dysfunctions, as well as chronic mental stress. So what is the mechanism and how is it the gut bad health causing the patients having this disease? For this patient, his bad gut health is because of his bad habits of taking food, in which he frequently take those food that actually like processed food as well as fast food, and because his schedule is actually busy, he's not eating the right timing for his body to digest properly, and because all these bad habits he has, so this makes him the gut is actually not healthy. There's actually imbalance of the good and bad bacteria for prolonged period of time, and this will lead to the immune systems are not correct. And with that, and on top of that, also he exposed some toxicity will lead to gut having a leaky gut, and which the toxin will cause irritations to the immune system, and this will lead to his immune system to attack his own body. So which is one of the root cause of his autoimmune problem. Because the liver is actually inflamed, yes, they will cause the high cholesterol problem. But for his case, actually beside the liver, of course, because the kidney is inflamed, there's leaky kidney, so there's protein actually leaking out from the kidney. So what happens is the protein become less inside the blood because of the leaky kidney. Therefore, liver will produce more cholesterol to compensate this concentration inside the blood. Therefore, the cholesterol become higher. It's a compensation mechanism of the body to maintain the we call it the pressure inside the and then the water retention inside the blood vessel. Therefore, the cholesterol become higher. Okay. One of the trigger of this possible cause of this trigger of this immune system become abnormal, okay. Because of the exposure of this unhealthy food. And also he had been taking a long period of time of the kind of oat drinks that he purchased, which he thought is healthy, take quite some time, and then I told him to stop it. That could be causing the inflammations in the gut, and this could be one of the trigger of the immune system become abnormal. Yeah, because of there's a leaky gut, and there's actually inflammation in the gut cause leaky gut, so the immune system become also get overreactive, and then that itself it could be causing the kidney being damaged because of the immune system is get haywire. The skin condition is actually it could be due to this nephrotic syndrome as well, because there's no really firm diagnosis where is it come from, but along the way he developed besides he having this urine from the protein, leaking urine the protein, then he developed the skin lesion. So the skin lesions, eczematous and also itchy, and both leg as well as the elbow. Even after he's taking these medications, including the steroid as well as the CellCept medication. These two medications can bring down the immune system, and also they will also cause possibility of these fungal infections in the gut as well after taking some time, because he had been taking for about a year these two medications, and along the way he's developed the rash on both legs as well the elbow. and it was quite itchy, and then make him can't sleep at night, and he has to scratch it and daytime as well. But the rashes become more and more substantial before he see me. Then with that, in my mind that actually these two medications can cause further infection because the immune suppressive. Yes, we try to control the inflammation through lack of attack to the kidney, but because of prolonged taking this medication, he likely due to infections of the fungal and also the toxin. That's why I do detoxification. At the same time, I give him these antifungal drugs to treat his antifungal medication to treat his this fungal infection, as well as a natural substance to treat his gut fungal. And it seems like 3 months down the road, the rash go away and the inflammation go away. And we are treating the gut as well as the immune system as well as the fungal infection. Along the way, his inflammation is still there, but because there could be underlying some viral problem in the gut, so I also give him some antiviral treatment using homeopathic remedies. That itself actually will calm down his nephrotic problem, as well as other inflammation problem, including the brain, which he has this forgetfulness, and the forgetfulness become better. There could be underlying the some viral chronic infections in the body, which is not been resolved and can trigger the autoimmune problem for himself.
Okay.
For this patient, basically is he having this dental amalgam fillings, and when I first saw him, they actually this eroded, and also it's been there for a long period of time. So dental amalgam consists of this heavy metal, including the mercury base, and also there are other heavy metals as well. I found he has been few. One is actually this mercury, as well as silver, as well as this nickel in him. So when I tested him from his blood, and when I did an further examination, I found he has this toxicity due to this. So how the heavy metal can affecting him? Every time he chew, every time he eat food, so the frictions between the teeth will leach this heavy metal into the mouth and into the saliva, and then he will swallow it together. So when he will swallow, what happens is will cause the inflammation. This heavy metal will cause inflammation in the gut, and it also will distort the environmental in the gut. Then this will lead to more this fungal growing inside the gut, as well as the bad bacteria. Besides that, actually this heavy metal will cause the damage to the tissue in the intestine, and it also will cause further, when they absorb, they will cause further damage to the liver. Of course, the liver try to excrete out this heavy metal somehow or rather, if let's say too much, they will absorb into the bloodstream. So when they go to the bloodstream, they can the body will try to excrete it out through the kidney. So when they excrete it out through the kidney, the heavy metals actually contacted with the tissue in the kidney. This will lead to the immune system going and attack that region. So and because the immune system becomes more haywire, what happens is they will produce antibody will attack against the kidney as well. So this could be one of the problem that he has due to the this heavy metal that is exposed from the mouth. Literally, when I check him, when I do the removal of the amalgams, he has a lot of symptoms being resolved when I tell him to do the removal of amalgam with a proper protocol, so that he don't get further poison from that, and this improve his condition tremendously. When I saw him at the first time, from the history taking, he's actually have a bad dietary habit for a long period of time, and because of his busy schedule, he's not taking care well his food intake. This lead to him having this this nutrient deficiency. So when I examine he has a few nutrients that actually significant deficient, which also including the vitamin B, which he had to get from the food, as well as also the zinc and magnesium, as also other trace mineral, and also the vitamin D3, which is very low when I first time took his blood after I examined him. When for this patient, when I took his blood and I found out actually he has this very low vitamin D3 in his body, even though he gets some exposure. So what I would do is for him that time, because of D3 is very important for the gut health, to make the lining of the gut to be healthy, and so that they can heal, as well as to make sure the immune system become regulated properly. So when I give him D3 actually to help his gut, slowly his gut symptoms go away, because the gut healing is taking place, and the immune system are not getting haywire because of the regulating well, and also it become healthier. And because of that, because leaky gut less, then toxin had less leak out from the kidney, in which less inflammation in the kidney, they lead to this nephrotic problem. And also because the immune system are more regulated, so they are actually less getting attacked to the kidney as well. Number 4 of root causes of this patient is actually hormonal balances. Because it's a prolonged chronic stress, as well as also his hectic work schedule, because he's a business owner. Chronically he's actually stressed out with a lot of work, and sometimes he's actually not sleeping well. On top of that, with the medication, make him actually the sleeping become not so good. This will lead to the deficiency of hormones. One of that he has is actually cortisol deficiency. Besides that, also, and I found out further investigation, he also have other deficiency hormones as well. This hormonal imbalances will lead him to actually having tiredness. On top of that, when the doctor give him the steroid medication, this will further depleted his cortisol in the body. For him, it's actually basically he has initially he has probably have high cortisol because of chronic stress. Along the way, the body, because there's nutrition deficiency, and then the body is overused, then what happens is the cortisol becomes slowly coming down, and with the additional medicine that actually given to him, the steroid medicine, this will suppress further the cortisol secretion. With the cortisol deficiency, the body unable to regulate his inflammation. Because of the chronic stress, the autonomic system become stressed out, and then this will lead to the chronic excretion of the adrenal gland hormones. When the adrenal gland hormones is being excreted a lot, then the nutrients also become depleted in the body in the long period of time. Adrenal gland will produce less cortisol hormones. When the cortisol becomes less, and on top of that, during that time we have this autoimmunes, they give corticosteroid medication. They will further suppress the cortisol secretion in the body. This will lead to the further inflammation in the kidney, as well as the other part of the body, including the gut, which that's why he had this inflammation gut problem, as well as the fatty liver inflammations of the liver problem. So all this will make the problem become worse. Therefore, he has the effect of the medication that been given that lead to the nephrotic symptoms is not being controlled, as well as he has other issue which is actually make him become worse. Another root causes of this patient is actually due to mitochondrial dysfunction. Because why? He is actually get the poison from the body. Examples are heavy metals, and possibly you're also having some organic toxin that actually poison the body. Because of the mitochondria is actually being poisoned, So what happened is the mitochondria cannot work properly, and also on top of that, he also have this lack of certain nutrients to help the body detoxify from the cellular level. So what happened is I give him nutrients, for example, alpha lipoic acid is one of that, and also the others nutrients that actually improve the glutathione level inside the cell, in which they detoxify the cell, and also the toxin that actually attacking the mitochondria. When doing this, what happened to him is the toxin in the body become lesser, the mitochondria start to work properly, then therefore the energy production of the cell become properly, and therefore the tissue become regenerate and also can recover properly. Therefore, along the way, after about 4 to 6 months down the road, after I giving those nutrients, he actually literally his energy improved so much, his sleep improved so much, and also certain part of the body is start to recover. Right, so it's actually we act on the cellular level in which to tackle the mitochondrial dysfunction. One of the root causes of these patients is actually chronic mental stress, because he has since teenager he has this family issue as well as working issue, and the influences from the society. So he has this stress level that always in the very higher side. Because of the personality, he's actually not a like to expressive person. So because of this stress issue, so he has this difficulty in sleeping. So he was taking medications, a sleeping pill and anti-anxiety medications to calm him down, as well as to let him sleep from medical doctor. Because of this overshooting of this stress nervous system, that can lead to the adrenal glands are not working that well. And what happened is the adrenal gland becomes over excretion over a period of time, then become depleted the excretion of this cortisol. This lead to the body become everywhere is having inflammation, as well as the immune system not regulated by these hormones, which is actually secreted not enough in the body when I tested on him. And on top of the medicine he take, like the steroid medicine, they actually suppress further the adrenal gland, together with this stress nervous system that overshooting to the adrenal glands as well as the thyroid. So this is one of the root cause of his problem, which I'm tackling for him. When I give him, because of this issue, I teach him how to relax, and then teach him how to sleep properly, as well as I give herbs and nutrients to correct this, and also homeopathic to correct this overriding of this sympathetic nervous system, which is a stress nervous system. And by doing that, the body become more calm, and he also personality become more friendly, as well as more expressive. And with that, then the condition become improved, and of course the overall body become improved as well along the way. And the treatment I adopt for this patient basically is actually very integrative, because it's actually exposed to a lot of toxin, and also there is actually hormonal imbalances, as well as the gut is the issue. So I started him off with this detoxification first, and it's followed by the IV chelations therapy to excrete those heavy metals out of the body, as well as the oral chelation I give it to him, because of the heavy metals that actually come from the amalgam denture exposure. And because of his essential nutrients is lack of, I give him his oral nutrients combinations according to his body lack of. And I also give him herbal medications in which to balance up the immune system, so the immune system not overreact to attack his kidney. So therefore that is actually essential to help him. And beside that, because the cortisol were low, I give him some bioidentical hormone to correct that, and also homeopathic remedies to correct this overshooting of this stress nervous system as well as the gut. That actually to repair the gut as well. Beside that, I also giving him this FIR therapy, okay, far infrared therapy, because the body is having organic toxin which actually we need to excrete out from the body as well. And beside that also, I giving him the wholesome food therapy because of his bad diet habit before this, to correct those nutrients that he's deficient. And beside that also, I encourage him to do exercise and also physiotherapy to correct his habit, the lifestyle that which he actually most of the time sitting in front of a computer, that lead to him having the hormonal issue. And also I teaching him this breath meditations therapy to relax his nervous system, that actually he always having this stress chronically that lead to him having the disease as well. For detoxification therapy, what's detoxification therapy? Basically, what I do is actually we correcting we clean up the gut, we clean up the liver, we clean up the blood, as well as we clean out the toxin from the body, which is actually consists of heavy metals. When I do the test on him, so we clean up, we excrete out those toxins out from the body, so the body are ready to absorb those nutrients and to get corrected after that. So IV chelation therapy basically is actually because it's actually exposure to this amalgam dental fillings, which consists of high heavy metals, include the mercury as well as silver as nickel. So which is actually is inside the body, we need to excrete it out from the body, because that it will disturb the mitochondrial functions as well as other enzymatic function in the body. So when we do the excretion heavy metal by giving the oral chelation as well as intravenous chelation therapy, this will excrete out those toxins from the tissue out from the body. Then those mitochondria as well as like the enzyme in the body can work properly. So for oral nutrition therapy, how does it work is actually because the body is lack of nutrients, the tissue, the organs are lack of nutrients. For example, the vitamin D. So everywhere when I tested his blood, the vitamin D level is very low in all the tissue. So I give him back the vitamin D3, and this will activate the whole body, can get corrected, and the repair start to happen. In which the vitamin D is very important for the health of the gut, to heal the gut as well as to regulate the immune system to be corrected. For the herbal therapy, what I do is, actually one of the things I use to help him is actually, because the immune system is actually overreactive in certain point, which they secrete those antibodies, attack the kidney. So what I give those actually nutrients to balance up the immune system, so that the overreactive of the immune system being tapered down, so that they don't attack to the kidney. And also, of course, I also give some herbal therapy to help his liver, because the liver was inflamed and the gut is inflamed. So we try to heal the gut and the liver, which to reduce the toxin absorption in the body, which can attack the kidney after that. So this is actually a mechanism I work on to help him. So for bioidentical hormone therapy, because his chronic stress, his cortisol was low, and this will lead to his adrenal glands are not working that well, and not producing enough cortisol. And because of the drugs that he take, the steroid medication to suppress the inflammation in the body before seeing me, so I giving him these herbs to help his regulation of the adrenal glands, and also to bring up back the adrenal gland health, and this itself help the adrenal glands to they can produce their own cortisol, and this will reduce the inflammation in the body and to reduce the damage to other part of the body. So, and also when the cortisol is in healthy range, they're actually able to regulate the immune system correctly. For homeopathic therapy, because we are treating the root causes of the problem, the homeopathic therapy that I actually deal with him, because he has this chronic viral leading to the immune system abnormality. So what I do is actually I give this homeopathic to correct the immune system, as well as to tackle this chronic inflammation due to this chronic viral attack to the body. And by doing this, correcting the root causes, the chronic viral inflammations become reduced. Therefore, the autoimmune problem is being resolved by doing this way. FIR therapy, okay. Because it has this organic toxin exposure from my examination, so therefore I give him this far infrared therapy to excrete the toxin, especially organic toxin, out from the body. By doing that, this organic toxin has less inside the tissue that can disturb the mitochondrial function, and also they also improve the mitochondrial function. Therefore, the immune system get corrected by doing that, as well as the tissue can repair. Right. Therefore, can be reduce the the immune system attack the kidney as well. The FIR, the effect on the FIR on him is basically there are a few things. Number one is actually his energy level become improved after he do about 10 to 20 sessions down the road, and also his body inflammation become lesser after doing this FIR treatment, because the organic toxin become lesser in the tissue, and also they actually cause the inflammation in the body and then lead to the immune system not right, that can attack the kidney. So which in subsequently can reduce the inflammation to the kidney as well as other organ as well. Okay. Right? Because it's not one issue, he has so many things. Nephrotic is one that. Okay. And on top of that, it also helps to correct the adrenal gland as well, indirectly, right? Okay. But one thing is actually it helps the most is actually his mitochondria. Okay. FIR can do as a part of treatment of mitochondrial dysfunction. Okay. Right? Because the body absorbs the energy, then the mitochondria will become regenesis. We call it reform and also recover by doing this way. Okay. FIR can do detoxification at the same time to bring up the energy. You absorb the energy, then the mitochondria work properly, and then it can bring out the mitochondria, and then also the energy production become better. And that itself can correct when the mitochondrial function become better, the metabolism become better. So what happen is correcting the hormonal issue. It also heal the gut, heal the liver, because it's actually a part of healing process. Another treatment I impart on him is actually using the wholesome food therapy, because his diet is actually prior to see me is actually quite bad. It's bad actually. So very lack of all those essential nutrients. So when I give him wholesome food therapy, including the vegetable blend, which actually we give because the whole body need different kind of nutrients, and also those small and those vitamins, minerals that actually help the body to work properly. They have to work in a very synergistic effect, in which none of them actually one the other one is actually we say that actually almost all of them is important. So the nutrients derived from food is much better than using the synthetic the vitamins and minerals. When you put those things together with nutrient therapy, it works very well to help the body to heal. For example, like the gut, when you give beta carotenes with all these the berries nutrients together with this vitamin D, it heals the guts and much better. So food therapy together with nutrient therapy is actually work very well. By doing that, if you reduce the gut leaky, that itself actually reduce the toxin going to the system that lead to the immune system haywire. So when you heal the gut, you heal the immune system haywiring. Because it's a sedentary lifestyle, he's not moving that much, and energy expenditure is not good. So what happened is, I tell him to do some exercise to build the muscle up as well, to improve the lymphatic system and drainage. By doing that, actually, you also help the body to have increase the metabolism, because whenever the body moves, the blood circulation become better, all right? The lymphatic system drainage become better, and of course they also help the gut healing as well. So when doing that, then the blood flow better, the body able to excrete out more toxin through the gut as well as to the kidney, less accumulation toxin in the body. Then what happens? The immune system get corrected, the border inflammation get corrected, right? Then also at the same time, you also help to build up the adrenal glands as well as the thyroid glands as well, right? That itself actually can build up the hormones and help to correct the body. Breath meditation therapy, because it's actually chronic stress, and then because the workload is so much, I told him to do regularly the deep breathing exercise, which actually itself, when you do that, by moving the diaphragm and also the lung in the using this meditation deep breathing exercise, that itself can reduce this stress nervous system, in which the over discharging of nervous system to calm them down. When they calm the brain down, then calm this stress nervous system down, then there's no actually overshooting of the nervous system towards these adrenal glands and thyroid glands, which lead to the hormone deficiency. That itself can improve the hormone productions from the adrenal gland, and this lead to the cortisol to be corrected, and when there's cortisol hormones get corrected, immune system get regulated properly. When get regulated properly, what happens is less damage to the immune system to damage the kidney. So because of this combination therapy, his symptoms actually resolve. The urine bubbling is resolved, and also the chronic tiredness resolved. And he's so happy for that because he can become more productive. And his sleeping difficulty, because the itchiness to the skin, leg and also the elbow become lesser, then he can sleep very well. And also his body swelling become less, he lose weight in fact, because of this accumulation of fluid inside the body, because of the Cushing and the Nephrotic syndrome. And he also having this skin rash also resolved, and the itchiness is resolved, as well as his hair loss also resolved, and the forgetfulness also resolved. He's become more productive and can think clearly now compared than before. And he also adopting healthy food. Then therefore the craving for this bad food actually become lesser, and almost he's actually when he talked to me every time, he actually really literally asked me what kind of food he can take, what kind of food he cannot take. He able to control himself not to take those food actually not healthy for him. Medical condition that is improved for this patient, including the nephrotic syndrome, it resolved about 70%. Cushing syndrome is totally resolved because all the signs and symptoms that actually he has, and even the blood test actually improved from that. So, and then also his fatty liver resolved about 70%. Insomnia, actually he actually no more insomnia. He can sleep well throughout the night, have no problem. Cholesterol problems actually resolved 80%. Eczema, the skin become clear up. The eczema skin is actually no more there already. high uric acid also resolved, and the gut symptoms like and also the acid reflux symptoms also resolved, because he has a difficulty in every time he may eat, the reflux symptoms make him can't eat that well, and he feel uncomfortable, and having this on and off diarrhea being also resolved, because the irritable bowel symptoms get better after that. The medication we wean off, including the prednisolone and also other steroid anti-inflammation drugs. His skin eczema cream, which contains steroid, also wean it off. Anti-anxiety medication wean off about 50%. The gastric medicine is totally wean off. It's not need to take for that. Sleeping pills is weaning off, okay, and also the traditional medicine is also wean off. Most of the patients were actually having this chronic kidney disease and also the nephrotic syndrome, and due to this, especially those autoimmunes, they have underlying other problems that lead them the immune system get unstable, or it become abnormal to attack the body. We have to find out the root causes, actually what actually causing them, instead of we just give the medicine to suppress the progressions of the disease, in which they actually is not dealing the underlying root causes that causing the disease itself. So therefore, there is actually essential for us to find out what actually that can lead them having the problem, instead of just giving the medication to suppress the progression of the disease. Therefore, investigation of root causes is important, and understanding each of every cases of this kidney problem which related to this autoimmune disease. We need to find out from the point of as an integrated doctor to help them, so that they can have a better life after that, because of they can have a choice not to taking so much medication to control the disease. Instead of controlling the disease, they actually can reverse the problem they have by finding the root causes and treating the root causes. So I would say that actually patients out there, that they should have a chance to find out what actually happened to them, so that we can help them to treat the underlying root causes, so that they're not dependent on the medication in a long period of time. And also they become have side effect what this patient have after taking the medication.